Welcome to the Mind Vine podcast, where we challenge the stigma associated with mental illness through conversations about a variety of issues impacting mental health. Here we bring you news, views, and interviews that intrigue, educate, and celebrate recovery. Leading us on this journey are the hosts of the Mind Vine podcast, Darryl Mathers and Chris Bovey.
Welcome to the Mind Vine podcast. My name is Darryl Mathers, and I am not with my co-host as usual. Chris is not here today, but in his place, we are blessed to have Amanda Sampson from our Center of Education and Organizational Development join as our guest co-host. Amanda, welcome.
Thank you so much.
Well, it's great to have you here. We're on the eve of Mental Health Week, and we're going to be releasing a few podcasts on a couple particular topics. And today we're going to kind of tackle women's mental health, and figured it would be good to have maybe your perspective on this as we kind of bring in a psychiatrist from one of our programs here at Ontario Shores. So thanks again for joining us. I'm pleased to welcome to the podcast Dr. Caitlin McKeever. So Dr. McKeever, welcome.
Thank you.
And so for people that don't know, you're a psychiatrist here at Ontario Shores. I think you're involved in a lot of different aspects of Ontario Shores and programming, but you do work with our women's clinic, more specifically to today's topic.
Yes, that's right. Yeah, I'm glad to be here. Nice to meet you, Amanda. Yeah.
Nice to meet you too.
So we're going to tackle women's mental health. And the first question, Dr. McKeever, would be, are there issues that are unique or more common in terms of mental health as it relates to women?
Yeah, there are some differences in the mental health of men versus women. For example, something really common, rates of depression are significantly higher in women compared to men. That's just one example. The reasons, why are complicated, and probably there are many reasons, but one thing that's more specific to women is hormonal changes that happen throughout the lifespan. So factors associated with puberty, for example, and then hormonal cycles that come with menstruation, pregnancy, childbirth, and then later in life, menopause. Each of those things really does influence mood and can increase the risk of various mental health problems, including depression, anxiety, and others as well.
So are the signs that someone is struggling with a mental health issue different for women?
Many of the signs can be similar between men, women, and anyone, but there are some, I think, specific to women. In some ways, I think it can be somewhat easier or more socially acceptable for women to talk about things like low mood and emotional difficulties, where it can be more stigmatized for men. On the other hand, there's reasons why women have a more difficult time sometimes accessing support, especially around perinatal or the pregnancy and childbirth. It can be hard, for example, if someone is experiencing symptoms of depression or anxiety shortly after the birth of a baby, to talk about that, because it's often thought of as the time that's supposed to be perfect and happy, and it can be hard for a woman to acknowledge that she is struggling. Sometimes there's fears too of that other people will be concerned about her ability to parent, and so there's reasons why women might not come forward to describe what they're going through. But in many ways, things are similar. I mean, people notice changes in sleep and their ability to do the things they usually like to do, their enjoyment of things, their energy level and motivation. And those are pretty similar between anyone who experiences mental health concerns. But I think some of the specific settings, contexts, and the ways that it gets expressed can be different for men versus women.
Thank you.
As I mentioned when we were introducing you, that you are involved with our women's clinic here at Ontario Shores. And I wonder if you could give us a little bit of an idea of, what is the women's clinic and what is some of the work that's done there?
Great. So our women's clinic at Ontario Shores, our focus is on women who have mental health symptoms that have been sort of made worse or gotten worse related to hormonal factors or factors specific to women. So just to be more clear about that, usually it means symptoms that get worse, like depression, anxiety around pregnancy or in the early postpartum period, like the first year is usually our focus. We also see women who have trouble with mood difficulties around their periods. So it's something called premenstrual dysphoric disorder, which is in some ways a little like PMS or but more severe and more debilitating. So we would treat and see women for those symptoms, as well as for mood issues, mood or other mental health issues that get worse or changed around menopause. We wish we had the capacity to see like all women with any mental health circumstances, but we try to focus on ones that are worsened or related to hormonal factors or factors really specific to women. And we try to do a course of treatment. So that means that might include treatment by me or our nurse practitioner, Julie Bisson, to do medication management and changes from that perspective. And it might also include therapy. So we mostly offer cognitive behavioral therapy and interpersonal therapy that's kind of short-term in nature, really trying to help people manage symptoms and move forward.
Before you jump in, Amanda, I just want to when we're talking about the women's clinic, it is called the Love You by Shoppers Drug Mart Women's Clinic on Ontario Shores. Because we work in the hospital, we refer to it as a women's clinic, and that's what it was known before. We had Shoppers Support, but I just wanted to clarify that it is called the Love You Shoppers Drug Mart Women's Clinic, and we're grateful for their support. So now you may proceed, Amanda. I just wanted to clarify that before.
That's okay.
Didn't give the proper recognition.
I actually had a quick follow-up question to the one that you just about. I'm curious, are the treatments, because you're dealing with hormones and things like that in many cases, are the treatments similar compared to other mental health conditions like the medications and things, or other options?
There is a lot of overlap in terms of the treatments. We use many of the same medications, for example, but we try to make sure to also approach it from like a holistic level as well. So that might include some different treatments. We try to work closely with people's family physicians and or obstetricians, gynecologists who might be helping to manage hormonal treatments as well. So there are some other things to consider. And we, although usually I don't prescribe those medications, I try to work closely with the other practitioners who would be helping us to manage that. So there are some treatments that can involve, for example, like hormonal contraception can, like oral contraceptive pills can play a role for some people in helping to manage mood shifts around their periods. And sometimes there are other interventions that can be taken, but we would try to work closely with the medical team basically to arrange those if that was appropriate. And otherwise, a lot of the treatments are very similar. The same kinds of therapies can help, and the same kinds of medications, for the most part, are used.
Great, thanks. So there is immense stress that comes with being an expecting or a new mother. What are some of the things to be cognizant of, during pregnancy and postpartum in terms of mental health?
It's a good question. I think with mental health, always, it's at least kind of a three-pronged approach, maybe even more sometimes that's needed. So you always have to think about things from the mental health symptoms and kind of causes from a biological, from a psychological, and from like a social standpoint, right? And parenthood has such huge changes in all three of those fronts. So pregnancy and new parenthood, even for non-biological parents, there are changes that happen hormonally. And then it's a total change in your sort of social role when you go from not being a parent to parenting a newborn, which has a lot of impacts. For example, and some people can bring up traumatic memories if they've experienced that in the past, or bring up difficult emotions from the past. Some people really, it's a big challenge to sort of adjust to the new expectations and responsibilities. And psychologically, that has a big impact. So, I think it's true with every sort of psychiatric or mental health concern that you have at least those three kind of domains to think about. But I think in parenting, in new parenthood, it really there are major changes in all three of those domains that can really impact how it's experienced and the kind of symptoms and treatments that are useful when people have anxiety or depression or other concerns around that time. Of course, sleep too. I didn't say that explicitly, but that's a major one. Anyone who's a parent, would know that your sleep is really impacted, especially in those early months. And that has a huge, we really know how important sleep is for mental health. So I guess I would think of that as one of the biological components of mental health, but it's a really important one to think about in those early months with the baby.
Yeah.
You'll probably never sleep the same again.
Yeah.
No, I don't think so.
Just talking about, kind of like postpartum, is postpartum depression, is it more common than we think or realize?
It is pretty common. So about 10%, give or take a few percentage points of women will experience postpartum, mood symptoms. It's even more common to have like a baby blues you might have heard of. That's something that happens. Probably 80% of people will have a dip in their mood in the first few days after having the baby. They might be very emotional, quick to cry. That happens, about 8 out of 10 women. The difference is that generally will go away in 3 to 5 days and gets better. And then in some people it doesn't, and it may worsen. Postpartum depression we think of as really, some people think of it as the first 3 months after the baby, but really we tend to think of it really in the first year that people can develop difficulties with mood or anxiety. And that's, like I said, about 10% of women will have symptoms that kind of continue and that become more, that affect their ability to function a bit more and are longer lasting than that initial baby blues sort of emotional period that is so common.
It's really interesting. So are women more likely to talk about issues they are facing and reach out for help?
I think that, like I said before, there is a little bit, and I think this is changing too, but there's a little bit more acceptance of women speaking about their emotions and difficulties with anxiety and mood compared with men, where it historically has been really stigmatized. On the other hand, like I said, there are different barriers for women. And I think especially new parents, and there's some stigma around, I think, for women talking about hormonal influences on their mood. It's often been something that's sort of been used as a way to imply that women aren't as capable in some ways. So there's some complicated history there, I think, that might prevent some women from speaking about it or from looking at it from that aspect as well, like the influence of their hormonal changes on their mood. And it has been sort of used against women in the past. There's a lot of terms that have been used that implicate sort of women's biology in their mood changes, and a small part of that is true, that biology does affect our moods and our levels of anxiety and other symptoms, and yet it does not imply that people aren't able to function and can't be as effective in roles that the same way men can be.
Yeah, I feel like as going back years ago now, but I can remember going through a time where it just felt hard, and you wonder, and I wonder if people recognize that that's, affecting their mental health, or if it's just that they figure, I can't do it all the way that I thought I could. And so you have to recognize sometimes that you have to be either accepting that life has changed,
mm-hmm.
or whether or not you might need more help than that. Right. Do.
I think it's true that as a society, the expectations we have of mothers are just so high and really border on impossible to meet, if not being actually impossible, in terms of trying to balance earning an income, working outside of the home, which is a necessity for most people in our reality, and also caring for a child. We are relatively lucky in Canada to have, for most people, relatively long maternity leave, but that's not accessible for everyone. There are a lot of people, for different kinds of reasons in terms of their employment, that may not have access to a paid leave. And that brings up a lot of challenges with, sleep and feeding the infant, and while trying to also maintain a schedule outside of the home. Women take on, tend to take on more of the household tasks of, running, organizing, planning the household. And a lot of that is seen as, in some ways, I think by some people, just the role of a woman or a mother to do. And that I think makes it hard for some people to ask for help, to acknowledge how difficult it is and impossible even to meet that. On top of that is the kind of, we all want, I think, as parents to have things as perfect as possible for our kids. And I think part of that adjustment in early parenthood, or maybe throughout the rest of parenthood too, is actually recognizing that it can't be perfect and you can only really do your best, right? And accepting that is good enough, for your child, that if they have a good attachment and you're responsive to them, that should be good enough. And you don't have to be perfect, right, as a parent.
Yeah, so true.
A perfect kind of segue into my next question. You might remember, like a few years ago, I was working with a patient from the Love You by Shoppers Drug Mart Women's Clinic, who was a new mom, and she, was experiencing, mental health issues, but she talked about the role that social media played in maybe exacerbating her issue, because she didn't feel the way that inside, she didn't feel the way that was portrayed on social media. She'd see pictures of, this is the greatest day of my life, and the perfect family, and like these images of mothers who seem to be doing it all with a smile on their face, and they're so grateful. And she wasn't, that wasn't what she was feeling. And I wonder if in your work, do you see the role that social media might play, negatively in a new mother's mental health?
Yeah, I do. I mean, I think that social media at so many different life stages and for so many people has that effect where nobody's posting a picture of their worst day, or even the hard moments. Rarely, you're not seeing that. So you get this kind of skewed view of what things are like for other people. And I think that can happen in depression and anxiety anyway, where we get a bit of distortions in the way we're seeing things, where it looks darker or worse than it really is. So social media, I think, can really kind of exaggerate that. So you're seeing that reflected, like this thought that you're not doing as well as other people, because all you're seeing in there is the highlight reel of someone else's day, where they've really cut out all the messy stuff from the background of their bedroom or what have you, and you're not seeing that in the frame. So it kind of reinforces those distortions that we tend to have anyway when we have mental health concerns like anxiety and depression. Right. There are some benefits of social media too. I think it helps people stay in touch, like especially through COVID. Like people can sometimes access local neighborhood groups, for example, on Facebook or elsewhere, and stay in touch and be able to actually have a supportive network. So it depends how you use it, right? But definitely you are mentioning something that comes up a lot and is a real phenomenon. I think there are ways to use social media in a way to actually help you get some social connection rather than to feel that more isolation and negative aspects of it.
Mm-hmm. So whether it's our partner, our mother, sister, friend, how can we support women in our lives who are struggling?
Being connected is a way that we can all support each other, regardless of life stage or gender. And I think reaching out and asking people how they're doing and really listening to what they say. And if you have concerns, like if you think they don't seem like themselves, or they're, you have any reason to really be concerned about their mental health, I think the best way is to let people know that there are resources out there to help them. Often one of the best ways to start the process is to suggest people talk to their family doctor about how they're feeling. And usually primary care, our colleagues can really help with referrals or with directing people to resources. Oftentimes they're able to even manage without necessarily referral to our clinic, although it could play a role. So I think offering support, being someone to listen to someone else, and then if you feel worried, then to suggest other options too, for them to have some professional. Not everyone who's feeling down necessarily needs professional support, but some might. And I think it's good to offer people that option so they know it's there, and then they can call or get in touch with supports should they need it if things are not improving or really affecting their ability to be themselves.
You mentioned earlier just how women still carry a significant burden in terms of managing a household, managing their own careers and work life. Do you have any advice that you would give women today about how to best manage, everything, that all their responsibilities, or that, in terms of looking after their own health as well?
It's hard. It's definitely a challenge, I think, for everyone. I think, and people face those challenges a bit disproportionately too. I mean, we know that racialized women of lower socioeconomic status would have more challenges, even with less money, for example, to pay for support, with less sort of employment opportunities, with less flexible jobs, oftentimes more experience of racism and other things that really negatively influence mental health and health generally globally as well. So part of what I guess we all need to do is try to improve those factors as much as we can by advocating that for equitable service and resources on a more individual level. I mean, I think reaching out for help, asking other people to help support you is important. Sometimes that's not an option. There are some people where they may not have anyone to call, but there are services there. So I would really recommend that people, if they're struggling, to start with their primary care or their family doctor as a place. They often have a lot of resources to suggest. And also to reach out to family and friends as much as possible, get the help that is there. If it's financially feasible to get help that way as well, to pay for some support in the house, just acknowledging that's not a reality for everyone, of course. I think, like we kind of alluded to before, using social media in a positive way as possible is important. So not scrolling through necessarily looking for people to compare yourself to negatively, but actually trying to join a group of people facing similar things, and they are out there. There are also postpartum support groups, pregnancy support groups that can be helpful to join. So those are some of the things I would consider, to look to other people. It's kind of maybe cliche, something that we've heard so many times, but it really does take a village to raise a child, and it's not possible to do it alone. Unfortunately, COVID has made it so much more difficult for so many people to really have that network of support, because we have to take into account, infection and not exposing the baby or not exposing anyone else, isolating for those purposes. That's been a really challenging thing. On the other hand, I think it's maybe made us all a bit more open to some virtual supports that have been helpful. We've actually been doing virtual appointments in the women's clinic since even pre-COVID, which has always been really helpful, because it was often hard for new parents to get out and travel to our clinic with their babies, et cetera. So we did some visits. We've been doing it for at least 5 years now. But I think that's because of COVID, it's really become a more viable option for a lot of people than it used to be. So as hard as that has been and as difficult as it's been, I hope that there'll be some long-term positive changes in terms of improving access for people who are far away, who aren't able to get out of the house because of childcare responsibilities, bad weather, whatever it may be, that will actually be able to help people more in those settings and more flexibly than we were before.
This is one last thing, and it's probably more of a statement that I get you to comment on more than anything. But in my experience, like, women, whether they're a mother or not, they tend to be really selfless and always putting everybody else first. I think it probably gets enhanced when you're a mother, but I think that's in my time on Earth, I would say that's an observation I have. How important is it that and I think men are better at taking time for themselves, maybe too much time, but I think, of caring for like self-care and taking what they need in order to be healthy. And women are women as good at that? Is that something that they, maybe generally need to be better at?
Yeah, it's a good question. And I think it's a complicated combination of social expectations that start really young, and also maybe some innate differences that women may not get the same reaction when they try to take time for themselves as men do. You know what I mean? So it's kind of a two-way loop. I think women do tend to internalize things more and to feel that they need to sort of meet the needs of other people before theirs. And I think that's something that it especially it differs culturally, but in many cultures, that's an expectation from a young age for girls and women. And it's a challenge, I think, to change that, even though, I think there has been a lot of progress in the way some of those things are viewed now. It's still there. I think there is still a different expectation, even for boys and girls and women and men, that makes it harder for women to prioritize their needs. And I think especially mothers and parents, because there is a real expectation that the child should always come first. And of course, childhood is a very important part, but you can't have a healthy, happy child without a healthy, happy, not necessarily completely healthy, but a effective, responsive parent. It's not necessarily a biological mother, but parent who's able to respond to their needs. So that means if you want to treat and make sure kids are doing well, we have to support parents too, and that includes mothers, fathers, and non-binary parents as well. That there are supports available for fathers in the postpartum period, and those are important as well.
Well, thank you very much, Dr. McKeever, for taking time today to talk with us. I found it very interesting.
Yeah, same. Thank you.
Learned a lot, and hopefully people find it useful during Mental Health Week, and thank you for all you do for our patients in our community.
Thanks so much.
Thank you both.
Thanks so much for having me.
Together begins and ends.